Ever pondered over the well-being of a cherished one and wondered if they might need a tad more support than they're currently receiving? It's something that struck us all, especially when our loved ones age, grapple with health issues, or face daily life struggles. This concern often leads us to wonder whether they require assisted living, a residential facility focusing on personalized care and assistance. Assisted living stands as a harmonious balance between independence and support, tailored to meet each individual's needs. But the question arises, when is the right time for your loved one to consider this option? It's not an easy call to make, but there are some pivotal signs that could hint at the need for assisted living. Here are some key signs to watch out for. Firstly, a noticeable decline in physical health is a significant indicator. This decline may take on several forms, some more subtle than the others. For instance, if your loved one has always been agile, but you start noticing them stumble more often, it might be a sign of deteriorating physical health. Frequent falls can result from declining muscle strength, poor or even neurological disorders. Another distinct manifestation of declining health can be changes in body weight. Unexplained weight loss could indicate a variety of health issues such as malnutrition, digestive disorders, or sometimes depression. On the other hand, sudden weight gain might suggest an underlying issue like hypothyroidism or uncontrolled diabetes. Moreover, a worsening of chronic health conditions such as hypertension, diabetes, arthritis, or dementia is another important signal to consider. A sharp or gradual increase in the severity of these conditions could indicate that your loved one is finding it increasingly challenging to manage their health independently. In such scenarios, it's crucial to have open and compassionate conversations about the need for external support or professional care. These signs may signal that they're struggling to manage on their own. Secondly, difficulties in managing daily tasks can serve as a revealing indicator. As with the ebb and flow of life, tasks that were once accomplished with ease may now seem like mountainous hurdles. These tasks could be as mundane and essential as bathing, the simple act of cleansing oneself, which may become an unforeseen challenge that disrupts daily routines. Likewise, grooming, an act that portrays one's personality and confidence, may also become a thorny task to accomplish. This can lead to a gradual loss of self-esteem and result in feelings of isolation. Next, let's consider cooking, the act of creating nourishment. This essential yet complex task might become an overwhelming chore, leading to undernourishment and potential health risks. Moreover, mobility, symbolized by the seemingly effortless task of walking, can become increasingly daunting. The freedom and independence it once represented may gradually fade, replaced with frustration and fear. As these daily activities transform from routine to obstacle, it might be time to contemplate the idea of assisted living. Such facilities are designed to provide help and support, ensuring the dignity and quality of life of its residents. If these activities become increasingly challenging, it might be time to consider assisted living. Another significant sign is a decline in mental health. This is particularly crucial to pay attention to, as it often can represent a profound change that should not be ignored. Mental health is one of the pillars of overall well-being, and when it starts to deteriorate, it can have a domino effect on other aspects of our health. One of the main symptoms could be confusion. This could manifest itself in many ways, such as forgetting familiar faces or losing track of time and place. Another alarming symptom is memory loss, which is not just about forgetting names or dates, but also includes more severe situations like forgetting important life events or how to do basic tasks. Changes in personality represent another crucial symptom. This involves drastic mood swings, unexplained outbursts of anger, or becoming uncharacteristically withdrawn or depressed. Such changes could indicate a cognitive disorder and should be taken seriously. This is especially true in cases of dementia or Alzheimer's disease. Isolation can be a significant indicator. When you notice that your beloved one is gradually retreating from active participation in social gatherings or events, or if it seems like their entire time is spent in solitude, it may be a subtle hint pointing towards a battle with feelings of extreme loneliness or severe case of depression. This withdrawal from society is not something to take lightly. It's a cry for help, a silent plea for companionship, or just a simple need to feel belongingness. These feelings of being isolated can stem from various reasons. It could be that they feel misunderstood or disconnected. Or it could be that they are battling health issues, which make it hard for them to engage in social events. It's to pay attention to these signs, to provide them with the right support they need. Assisted living facilities can be a boon in such situations. They offer an array of social activities, a sense of community, and above all, they provide a platform to interact with others going through similar experiences. This interaction can significantly help in addressing and alleviating these issues. Lastly, if the caregiver's health is beginning to falter, it's a stark signal that the existing level of care may not be adequate enough. The role of a caregiver is one filled with numerous responsibilities, and oftentimes, these individuals neglect their own well-being in order to cater to the needs of others. As they continue to provide care, they might start feeling the strain both physically and mentally. As they push through each day, their energy diminishes, their stress levels rise, and before they know it, their health starts to decline. The constant need to be available, to be alert, and to provide compassionate care can indeed be physically draining and emotionally overwhelming. But it's paramount to remember that caregivers are humans too, and they need to be cared for. Their health is equally important, and in fact, it is vital to the effective care they provide. It's crucial to ensure that caregivers also look after their own health. In summary, the key signs that indicate a need for assisted living include a decline in physical health, difficulties with daily tasks, a decline in mental health, social isolation, and a deteriorating caregiver's health. This decision is monumental. It's crucial to notice these signs early to ensure your loved one receives the care they deserve. The goal isn't to restrict their freedom, but to offer the support they require to live a secure, healthy, and fulfilling life. In this regard, paying attention to signs such as reduced health, difficulty performing daily tasks, diminished mental health, social withdrawal, and a declining caregiver's health can act as important pointers. Remember, the ultimate goal is to help them enjoy life to the fullest, not to limit them. Thus, if these signs resonate with you, it might be time to open a conversation about assisted living with your loved one.